Before we get started, we'd like to make an announcement. This is a sensory-friendly event. Sometimes the clapping disturbs some of the children, so we'd kindly ask everyone to refrain from clapping for our presenters. Alternate options are to wave your hands in the air, or do a golf clap. We thank you for your consideration. Good morning and welcome to everyone here in the room and to everyone joining us online. For those who were here with us yesterday, welcome back. For anyone joining us for the first time today, we're so glad that you're here. For those who don't know us, I'm Eva Tucker and this is Liz Astridge. We have been the co-presidents of the PURA Syndrome Foundation since 2023. But first, we're moms. Liz is mom to 4 children, including Pura Perfect Owen, who is 8, and he's here with us today. And I am mom to 3 children, including William, and William has a rare 5q31.3 deletion, not including Pura, but he shares so many of the same challenges, and this community has become his too. So for Liz and I both, this work is personal.
Take a look at this map. Between our in-person and virtual registrations, we have families joining us from more than 20 countries. Coming together in Munich this year means more of our European families can be in this room, and that means the world to us. Pura is rare, and it can feel isolating, but no one here is alone in it. That's the whole reason we gather. This morning, we want to give you a picture of where the foundation stands, what this past year has built, and where we're headed. But first, we'd like to express our gratitude to everyone who made this conference possible. Our conference contributors include myself, Nancy Baccia, Damon Fisher, Jenny Harold, Eva Kate, Nora Klein, Selena Lozano, Chris McGill, Dirk Niesing, Vera Roman, Bettina Schmid, Ursula Seifert, Eva Tucker, and Melissa Vaught. And we'd also like to extend our thanks to our speakers today too. I won't go through all the names, but we're very grateful for everyone's time and efforts.
For families who are newer to us, we'd like to talk a little bit about the foundation. The PURA Syndrome Foundation was founded in 2016 by a group of PURA parents, people who are exactly where many of you have been, a new diagnosis, very few answers, and no roadmap.
Our mission is simple to say and big to do, to support and drive research, raise public awareness, and connect, educate, serve, and empower families impacted by PURA syndrome. We're a global, family-led organization run by parents and volunteers who understand this firsthand because we're living it too. Our core values are respect, everyone is valued, community, everyone belongs, teamwork, foundation, families, clinicians, and researchers as one, continuity, we are working to build a strong foundation for future growth and change, and responsibility, ethics and governance are an important underpinning of everything we do. None of this happens without the people behind it. This is our 2026 Board of Directors, a group that gives their time on top of everything else they're carrying because they believe in this community. We would like to take a moment to thank our board members and our research liaison, Jim Legowski, who's sitting up front here, and our new fundraising chair, Brian Jobin, for everything they do. This group truly embodies the core values of the foundation. When navigating challenges, we always come back to the same question: what is best for our PURA community?
In 2024 and closing in 2025, we launched the Together for PURA campaign to mark 10 years since PURA syndrome was first named, and this community showed up. It became the most successful fundraiser in our history with over $250,000 raised. And we want to show you exactly what that made possible, because it's a direct line from your giving to real progress. The biggest piece is research. 4 new grants totaling $247,000, the largest research investment this foundation has ever made.
But it also let us invest in the foundation that research is built on. We upgraded our patient registry, you'll hear much more about that later today, and we began building something called a disease concept model. In plain terms, it's a structured way of capturing what life with PURA is actually like: the symptoms, the daily realities, what matters most to families. It's a real building block towards treatments. Before anyone can run a clinical trial, they have to know what to measure and what counts as meaningful improvement. The disease concept model is how our community's experience becomes the foundation for that. It's one of the concrete ways we are getting research ready.
And we've also been pursuing an ICD-10 code for PURA. That's the medical code a doctor enters at every visit. Right now, PURA doesn't have its own, which means our kids are often invisible in the health data. A dedicated code helps with recognition, with insurance, and with researchers being able to find and count our community population. It's foundational, and we're working hard on it. This is what this community did together to propel PURA forward, and the momentum continues to grow.
So here's the research Your Giving funded: 4 grants to 4 teams around the world, each coming at PURA from a different angle.
Without getting deep into the science, Professor Christopher Reed in Australia, who we'll hear more from today, is working to understand why seizures happen in PURA using a PURA mouse model his team developed with PURA Australia. Seizures are one of the hardest things many of our families face, so this work really matters to us. Dr. Benjamin Kokenauer is studying how altered PURA alpha proteins behave in cells, whether they interfere with gene regulation and how they affect brain cell development, which could have real implications on how future treatments are designed. Dr. Kyle Fink and his team, including our own PURA mom and board member Selena Lozano, are building human neuron cell models to provide a foundation for understanding how PURA affects brain development, identifying biomarkers, and supporting future therapeutic discovery. And Dr. James Dowling is exploring gene therapy approaches for PURA, early work investigating whether replacing the gene could one day be possible.
We relied on a team of reviewers from our scientific advisory board to evaluate the proposals and received great feedback on all 4 projects. We think of these as seed grants. They're meant to launch promising work, to give these teams the early results they need to go after the much larger funding that real treatments require. Our job is to invest early in the questions that matter most to our community, so this research has somewhere to go next. We're proud of every one of these projects and grateful to the families who made them possible.
Alongside the grants, your support has gone into building the tools that all PURA research depends on. And the biggest of those is our patient registry and biobanks. We're not going to go deep here because there's a whole session dedicated to that later. But the short version is that this is how researchers get the data and the samples they need to understand PURA and get us closer to potential treatments. If there's one thing that we hope you'll take part in, it's this.
There's also something new we're excited to announce: an EEG bank built through our partner, Combined Brain. The idea is to gather EEG data from across our community into one shared resource. Epilepsy is one of the hardest and most frightening parts of PURA for many families, including my own. The bank can collect EEGs your child has already had and can also collect new EEGs at Combined Brain roadshows or through in-home collection. Here's why this matters. EEG biomarkers aren't fully qualified for most rare neurodevelopmental disorders, so EEG data could help researchers understand PURA seizures and, in time, support trials. This community has lost members, children and adults we love, and every loss is devastating. The hard reality is that we have almost no reliable data on mortality in PURA syndrome. What we're seeing, why, or what might make a difference. There's a gap we feel a real responsibility to address.
So our board has committed to join a mortality study led by Combined Brain. It's a structured study across many rare neurogenetic disorders, which means we learn alongside communities facing similar questions, and we don't have to build this alone. Importantly, we've also chosen to fund a dedicated PURA-specific analysis within that study, one that will be published, so that this isn't only contributing our data to a larger pool, it's making sure PURA itself gets examined closely and that what's learned comes back to our community in a form researchers and clinicians can use.
When the time comes, families will be invited to take part only if they feel ready. What we hope comes from this is a clear picture that leads to real guidance and better care for the families with us now and for the ones who come after us. Doing this work, even though it's hard, is part of what it means to care for this community fully. We don't do any of this alone. The grants, the registry, the biobanks, the EEG bank, the mortality study, every one of those exists because of a partnership.
At the center of so much of it is Combined Brain, a nonprofit that helps rare disease groups like ours pool our data, our studies, and our infrastructure so that small communities like PURA can do things we could never do on our own. They have become an important partner this past year. So much of what you've heard about today runs through that relationship. We are on sometimes multiple calls a week with Combined Brain and the consortium of rare disease groups and stakeholders they bring together. But they're far from our only partners.
We're part of a whole network, fellow rare disease and epilepsy organizations, research partners, and other PURA foundations around the world in Australia, Germany, Poland, and beyond. We share what we learn, we avoid duplicating each other's work where we can, and we move faster because we're connected. For a community of our size, these relationships are how the work actually gets done. We are genuinely stronger together, and this slide is a picture of that.
We've talked a lot about what we're doing to support research, but the other half of what we do is showing up for our families right now. And so much of that is connection, making sure no one navigates PURA alone, wherever in the world they are.
A lot of that runs through our PURA ambassadors, volunteers who serve as the welcoming face of this community in their own region and language. We have ambassadors across France, Germany, Italy, Spain, South America, India, and the US. So when a family gets a diagnosis in Madrid or Mumbai, there's someone who speaks their language and knows their system, ready to help. It's one of the truest expressions of what this foundation is.
We also have ambassadors for specific needs, a siblings ambassador building a network for the brothers and sisters of our PURA individuals who carry their own experience of this, and our grandpops community for the grandparents who bring so much love and fierce advocacy to our families.
2 more resources on our website right now, our clinician directory, a growing list of doctors who actually know PURA, and our caregiver self-care resources, because supporting your child has to start with supporting yourself.
And a couple of things in progress. We've joined the Neurology Social Services Network, which connects families with social service support. It's US-based for now, and we genuinely need volunteers to help us build it. And we're applying for grant funding to launch a family support grant pilot to help families cover the equipment and services insurance so often won't. It's not guaranteed yet, but we're pursuing it hard and we'll keep you posted.
Everything we've shared today, the grants, the registry, the biobanks, the EEG bank, the mortality study, the support for families, all of it is possible because of this community. And we're not slowing down. Today, we're launching our next Together for PURA campaign with the goal of $300,000. That money goes straight back into research and the infrastructure you've heard about, the work that's moving us step by step toward treatments. Every gift at every level is part of that.
And before we close, we'd love to see you again next year. Our 2027 conference and scientific meeting will be in San Diego, June 25th through 27th. This community is the reason any of this works, and getting to be in the room with you, whether it's in Munich this week or San Diego next year, is the best part of what we do.
Thank you for being here, for the work you do every day for your families, and for everything you make possible. Our door is always open, and we can't wait to see what's ahead together.